Okay, well, we'll go ahead. It is 9:02, and I want to make sure that we stay on time and get you guys in and out in the time that I asked you to be with us. So I want to welcome you and good morning, students. My name, of course, you know, is Corinne Coulter. If this is your first time joining us for industry panel, we welcome and excited to have you here today. This is our healthcare industry panel. And so this, like all of the others that we've done, is a very popular one just because so many of you students here in Montgomery County are interested in going into the healthcare field, but you're not 100% sure what that could look like or all the different avenues in which you can get there, all the different kind of individual industries that are within the healthcare sector. And so today I'm excited to have a panel of professionals who have taken different routes to get to where they are started in one place and have been able to advance into different kind of positions throughout their career and be able to answer your questions about what you could expect if that is going into the healthcare and becoming a nurse or following in some of these same paths, what that could look like. So today we'll be here about an hour, hour and a half. As long as you guys are asking questions, you know, students, that I always have my list of questions ready to go, but this panel is for you. So I will continue to ask as long as you guys are engaging and wanting to know, but I really do encourage you to take advantage of this time and ask the questions that you have. You can either, since we're a smaller group, you can just unmute and ask. I will ask that you turn your cameras on, and then you can also use the chat feature if you would like to submit your questions there. So to get us started, I'm going to have our panel introduce themselves, and then we will jump into our Q&A. So as they're introducing themselves, be thinking about the questions that you want to ask to help get us started. So Tennille Campbell, I will turn it over to you to get us started in introductions. Oh no, I can't hear you.
Better?
Okay, yes.
Okay. Hi, my name is Tennille Campbell. I work at MD Anderson Cancer Center in the Woodlands at our Houston area location. I am currently the nurse manager for all of our clinics, our radiation oncology clinic and our ambulatory treatment center here. I started out I graduated with my licensed vocational nursing degree at 19 and went straight to MD Anderson and started working there. They hired me right off out of graduation. And then with the institution, I have gone back to school. I got my associate degree of nursing. And then I went back and got my bachelor's degree of nursing. And I've been with MD Anderson the entire time. Worked inpatient, was a code nurse, worked in ICU, worked surgical floors, medical floors, and then transitioned to outpatient clinics and worked my way up to assistant nurse manager and currently have been the nurse manager for the last 5 years.
Great, thank you so much for joining us. Okay, Emma Arnott, I'll turn it over to you.
Hi, good morning, everyone. Thank you, Corinne, for inviting us to speak with the students today. My name is Emma Arnott. I am a nursing director. I've been a nurse for 14 years, so similar to Ms. Tennille, I went straight into nursing right after high school, and I graduated with my bachelor's from Bloomfield College, New Jersey. I'm currently with Memorial Hermann in the Woodlands. I am the nursing director over 3 departments: pre-anesthesia clinic, our post-surgical care unit, and then our joint center. So my nursing journey, I really started with 1 year on a renal transplant / med-surg unit back in New Jersey. And I quickly relocated to Texas when I had an opportunity to get some warm weather. So, and I've been with Memorial Hermann since. I did take a small hiatus and went to the VA in Houston when I completed my master's in nursing and healthcare administration. And again, I quickly came back to my home of Memorial Hermann and continued my leadership journey with being a manager over our observation unit. I then inherited a oncology med-surg unit and then promoted to nursing director 3 years ago. And that is the role I'm currently in.
Wonderful. Thank you for joining us. Okay, Kendra, I always say your last name wrong.
It's Windish. Just ignore the
Windish.
C.
Okay.
Makes it easier. Thank you. I'm glad to be here. My name is Kendra, and I'm with MD Anderson Cancer Center, also in the Woodlands area. I don't work in the clinic. I work out in the community, and I've not been with MD Anderson as long as Tennille. I've been there 9 years, but in my career, I have done cancer prevention just for the last 9 years, but I've done injury and disease prevention. I was adding it up last night. It's almost been 30 years. So I'm glad I've been able to be in this field, and I've done lots of different things, but now just focus on cancer prevention. I did my undergrad at Sam Houston State, and I had a double major of community health and psychology, and then went on and got my master's degree in community health, now called public health. It had a different name that many years ago, but now at Sam Houston, it is the School of Public Health. So happy to be here and can't wait to get some questions. Thank you.
Thank you, Kendra. All right, and Alicia Este.
Hello, everybody. My name is Alicia Este. I am a nursing director at Houston Methodist, the Woodlands Hospital. I oversee our critical care unit. I'm also over dialysis. Also oversee our house supervisors who kind of run the day-to-day operations of the hospital. And I also oversee our Life Gift program. I've been with Houston Methodist since 2006. I started here as a graduate nurse. I got my undergrad from LSU in Baton Rouge, and then transitioned to Texas with my husband. I started as a graduate nurse, as a baby nurse, and the CVICU, the DeBakey unit at the medical center, and then kind of worked my way up through there, transitioned to a manager in PACU. And then when I heard they were building the hospital out here, I kind of took on some extra things so I could be the director of the unit here. I received my master's degree from Aspen University, and next month I have all this spare time in my hands. I'm going to start my DNP program. So I'm sure I'll regret it later, but I think it'll help me further my career. So my daughter starts high school, and then I start my DNP program. So it'll be fun times. So I've really enjoyed working with Methodist. That's why I've been here for so long. And I really enjoy working in the community that I live in. So I'm glad to be here today.
Good. Congratulations on that. Thank you guys again for joining us. Students, this is your time, and we'll turn it over to you guys if you have any questions. You can, since we're a small group and I can see you guys on my screen, you're welcome to just unmute yourself and ask away. If not, I will go to my bank of questions that I have. But do I have anybody that wants to start us off first with the first question?
So, what role does a nurse typically play in a clinic or hospital?
And that can be turned over to any of you guys. You don't have to go in the same order. So
I can take that one.
Typically, a nurse inpatient, you are assigned to a set of patients for the day, and it is your job and role to assess them, determine what the problem is or the goal that needs to be addressed for the day. So, for example, if they're in there and they need they're recovering from surgery and they're having difficulty with pain management, then you work with your patient to set a goal of how to help them control their pain and get up and walk, and you work with the entire team, which is social work, nutrition, your physicians, your advanced practice providers, your medical assistants or nursing assistants on the floor. And it's really a teamwork and collaboration to help that patient get as healthy as they can so that they can go home. The whole goal when a patient is admitted is to start discharge planning and try to help facilitate all the needs that they will have, so that when it is the day that they get to go home, that they're prepared for it, their family's prepared for it, and that when they do get home, they have all the resources that they need to be successful at home as well.
Yeah, the other thing I would add on to that is, in addition to the inpatient space, you do have nurses in other significant roles within the hospital. So like clinics, for example, we have nurses that are assessing patients and getting them prepared or optimized, as we call it, for their surgical procedures. So when they come in, a lot of that education and all of the expectations are already set, to Tennille's point. So when they come in, they know we're already preparing them for the next steps or the next level of care. And a lot of that is supported by the nurse, going alongside with the patient and their family members to discuss the journey and remove any barriers so they are well prepared and educated to go home or to the next level.
Great, thank you, Jonathan. Okay, Mary, if you would like to ask your question, you can go for it.
Yes. So I can assume that the nursing field is also very stressful, but also that, you had something that pulled you towards it. So what gave you confidence in yourself that you could get through the hard times in nursing school or times on the floor that it was stressful?
I'll take that one. I think it's super important to surround yourself with a support system. For me, I think when I was young in my nursing career, I identified a mentor that I could go to, whether it was get feedback, vent, what would you do in this situation? So I really think whether you're in nursing school or whether you're in earlier in your career, I mean, I've been a nurse since 2006, and there's times that I still reach out to my mentor. So I think it's very important to surround yourself with people who you know is going to give you solid advice and challenge you when you need to be challenged. So that's just my advice.
I'd like to add to that. I think one thing that is really important, and sometimes you don't think about it in the beginning of your career, is to have a good outlet, a healthy outlet. Whether that be find a hobby, and I think a lot of people are like, oh, hobbies are for older people, but that's not true. Regardless of, whether it is, reading or sitting outside or, going jogging, exercising. I think that definitely, just because you're right, healthcare can be stressful. We deal with very sensitive topics. We see, we, especially with oncology, I mean, you're dealing with individuals who are facing a very hard diagnosis and a hard journey. And sometimes it doesn't always come out well. And so instead of taking that home with us, one of the best things to do is to find a positive outlet so that you don't let it impact your personal life as well.
Thank you. Okay, Ismail, do you have your question? You can unmute yourself and ask.
So with things gradually becoming more automated today, how do you see the nursing profession and healthcare in general? How do you see it faring as machinery and AI slowly intervenes into your profession?
Ishmael, I think that's an awesome question, because I was just reading something in the Journal of Nursing about artificial intelligence and what that means for the future of nursing. And really, it looks like it's a positive outlook and a benefit to nursing as we continue to advance in technology and the data and information that continues to come into our healthcare space. We need help. We need help trying to synthesize and assess and evaluate all of the information and how we can utilize it to render the best care for our patients. So artificial intelligence is already here. We have it in other environments, the industry of engineering and aircraft. It's here already, and it's even in our space as bedside clinicians. However, I don't think we know how to best optimize it yet. So I am personally looking forward to how when a patient comes in, we can promote, or we can already foresee that a patient is going to perhaps have sepsis. Could we not give some medications and some fluids earlier versus waiting for the patient's vital signs and some other late signs to tell us it's time to do something for a patient? Or could we see that a patient has early signs of congestive heart failure? How can we start to have those conversations about diet and exercise early versus waiting for something bad to happen to a patient and they have bad cardiac output and things like that? Then we start looking at tertiary prevention. So artificial intelligence and definitely the utilization of that technology, I think it's going to bring more of a value to nursing, in addition to allowing nursing to do what nurses really want to do, which is care for patients.
And I can add on to that. In the critical care setting, especially during COVID, one of the things that we rolled out was virtual ICU. So there's basically a TV screen in each room, and new technology doesn't necessarily replace the people. It's just extra tools in your pocket to achieve those outcomes you're trying to achieve. So with virtual ICU, there is another nurse and intensivist in the background, and they're utilizing predictive analytics to hopefully prevent events from occurring. And so during COVID, when resources was scarce because we had a lot of people out with COVID, we were using that manpower to assist with writing orders, helping take care of patients. The camera system on those systems were so good, they can zoom in and read the exact medication that was hanging on a bag. We also have cardiac machines who utilize predictive analytics that can tell us when a patient may have a low blood pressure event and things like that. We have Amazon devices in all of our patients' rooms. One thing that we have coming is the patient can say, call my nurse. Instead of them trying to find the remote, it'll say, call my nurse, and it'll ring to the nurse's station. Another thing that we're doing is the nurse can speak into a device and document some of their assessments, so that way they don't have to be tied to the computer. So if we can get them out in front of the computer, it's more time they can spend with our patients. So right now, I think we're really trying to use technology to free up the nurse instead of adding more tasks in their bucket. So those are just some things that we're doing at our hospital.
If I can add to that, Kendra, I know you're out in the community and you're doing the kind of cancer prevention and things like that. Was there an element of technology and things that played into the last 2 years during COVID, when maybe a lot of the community events and things weren't happening, to be able to get that information out to Montgomery County or surrounding areas? Like, was technology a big implement of that?
It was. I mean, with what we're delivering doesn't necessarily utilize it, but how we deliver it. So one thing that was positive for us, we were doing cancer prevention programs just in the Houston area to people we could get to. And then during COVID, we were able to, because of Zoom or other platforms, we were able to deliver our programs all over the United States. And I did a couple of programs in Canada for employees there of companies. And then we had someone else on our team worked with the Mexican consulate and did programs all over Mexico and South America. So we're just able to deliver programs further reach. So it's worked out in those ways. I did miss the people though.
Great, thank you. I did want to ask, so students, if you have a question, just type in the chat, or we can move on to yours. But I know we have, just based on the students that are in the room and some of the internships that they're a part of virtually, I know we've got some IT technology, we've got some business, we've got there's some marketing. So there's a crossover of students that are interested in healthcare, but also maybe some of the other, they're interested in exploring some of the other routes. How, if we have a student that healthcare, nursing, but also the business side, which a lot of you have kind of entered into that level of kind of leadership, that maybe there's a little bit more as far as like the administrative roles. What is the crossover there, or is it encouraged for students to be able to, if they want to go nursing, but also have business classes and things like that? What would you guys recommend if we have some crossover here with this group of students that are on the call?
know one thing I always wish I had done was take classes about budget because I did not have any of that, and I have always needed it. So if you have a chance to do something like that in a business, if you don't, because I had no business classes with my degrees, so I wish I went coming into the healthcare setting, I wish I had known how to do that. So keep that in mind when you're choosing your classes.
Yeah, I mean, I agree. And being a nurse, you interact with all those different disciplines. So, with community outreach, marketing's involved in that. We have equipment, it breaks. So we're constantly in communication with biomed. As Kendra said, with finance, every year we look at our budget. At the end of the day, let's be honest, a hospital is a business. And, with market changes and stuff like that, sometimes we have to tighten our belt. So we're constantly looking at our budget and what we could do better at. So we work closely with our CFO on setting, and setting those budgets and making sure we have the money in the right place. So it's super important that you collaborate with those other disciplines in the hospital so you can be effective in your own role.
One great thing about nursing is there's so many areas that you can be over. I mean, if you have a love for, taking care of people, but then also have a love for IT, there's nursing informatics. And they are a vital part, especially now with our medical record all electronic, and trying to help us make flow sheets that, integrate with our system, and charting faster and easier. So there are a lot of business opportunities in the medical industry, as well as we have a whole business service with nurses on it, and individuals who just have business degrees, and individuals who just have high school degrees. So it's a platform of where you can come in, and it's being able to help get a patient in, make sure that their insurance is cleared, help prepare them for potential costs so that they know ahead of time, make sure that you review the medical records so that they are seeing the right physician, so that we are assisting with getting them care as fast as we can, instead of delaying it.
Yeah, when it comes to the healthcare environment, nursing is everywhere. And to Tennille's point, it really depends on the student and where they want to go and what they want their specialty to be. So once you get into the healthcare space, really tapping into the education that's provided. I don't know, all of these organizations have a wealth of resources and opportunities for you to attend workshops and seminars to really give you the education and the knowledge to start your journey and your pathway for where you want to end up. I mean, we have nurses that are legal nurses that review charts all day and make sure, when we go into litigation and things like that, we're well prepared and we have the documentation that we need. So we have flight nurses, they run around in helicopters all day. So it really just depends on what path they want to take and looking at the opportunities to get there.
Great, thank you. All right, students, do you guys have any questions?
What was your process for discovering what you wanted to do? And what about nursing specifically was it that made you want to, this is why I want to be a nurse, right?
I can take that. I can start. I would say I have a sister who is a lot younger than I am, and she was born with a very rare liver disease. And so we're about 14 years apart. So I was pretty much like her best friend, and we spent a lot of time in the hospital. She's had to have 2 liver transplants, and it was just kind of being in that environment and seeing how nurses impacted the care, from the time that she was born and throughout her entire life. She was in the hospital in and out constantly. So it really made me want to be a part of that. When I went into nursing school, just gung-ho that I was going to be a pediatric nurse, that, since that's what I saw. And then throughout all my rotations, because you get to see all these different areas and fields that nurses can be involved in. I did a rotation at MD Anderson and just really fell in love with oncology and cancer patients. And so that's where I have been since 1998. And I think it fills my heart and soul to be able to walk into a room and see someone who's having a really bad day and help them realize that we as together, we can help each other get them back to where they want to be, and at least in a place that they're happy with. It might not be that you can get them back to 100% of who they were prior to coming in or you seeing them, but at least help them reach the goals and or have quality of life and time with their family. So I would say that nursing is a job that continues to give to you just as much as you're giving to others.
I think for me, how I knew nursing was for me was simply because of my my family background. I am the oldest of 4, and we have a large family. So being the oldest by default, you're the babysitter, you're the caregiver, you have to lecture and teach and do those things. So nurturing became natural to me, and I knew nothing else but to do something in healthcare. I actually thought I was going to be a pediatrician. I quickly changed my mind to when I started my rotations to see that nursing really are the drivers and the caretakers of patients. So that really sold it for me when I saw the advocacy at the bedside and saw that, the nurse was the one that really spent time with the patient and really made an impact on the family and the patient's outcomes as well. So that really is the key driver for why I went to nursing school specifically.
And I wasn't one of those people who knew I was always going to be a nurse. Actually, when I started school at LSU, I was actually a chemical engineering program. And about towards the end of my sophomore year, I just felt like this wasn't going to be meaningful work for me. So then I started talking to the counselors and exploring different career opportunities. And that's where nursing came up, and I changed career paths, and I haven't looked back since. Since then I've had a child who was born with spina bifida. And I feel like if I wasn't in this career, I would not been able to advocate for him as I have. And so nursing has blessed me a lot and my family. So I'm very fortunate and blessed to be in this field.
Although I'm not a nurse, I can tell you how I got so interested in prevention from an early age. I saw obviously the benefit of prevention and how much less suffering there is if we can prevent something, whether it's an injury or a disease. I saw it in our family. I had a lot of health issues as a young person, and how devastating it is financially as well to you and your family. And so just, and then starting to learn about how many millions and even billions of dollars we spend on things that not everything is preventable, but things that are, and we can really, as a country, can really go in a different, just kind of go into a different space and save a lot of suffering. And so that's why I got into that and why I was so interested in that field.
Thank you. What is, you can have one, you can have multiple that you would like to share, but what is one transferable skill you recommend the students start to learn and cultivate now, to have to use now, but also for forevermore, I will say, because some of the things that you guys say are ones that will stick with us no matter how far technology goes, or what roles they end up in. But what's that one skill you recommend?
I'll take that first part. I think for me, especially going through COVID, it's been communication and having that people skill, because there's been so many rapid changes, even since we've opened in 2017. We've had the flood, we've been through a pandemic, and it was just rapid fire change. And you have to have the ability to communicate with your teams and keep them motivated. And we're still going through change. So for me, it's just having those people skills and keeping them motivated, crucial conversations, and going through those rapid change processes. Because I feel like if we didn't have the communication, we would have not come out where we are today.
I completely agree. And then having to, excuse me, talk to different groups of people and how each of them perceives what you're trying to say. Excuse me. Because when we're out teaching about diet and exercise, there are certain groups of people that really look at diet differently, and we have to go in and, and make sure that when you're speaking to different cultures, that you're aware of that, so that you can get your point across, and you don't want to offend anyone, but also you want them to take your information and run with it, really, and utilize it. So if you're telling them in a way that they understand it, that they can actually utilize, then you'll have a good outcome.
I would say grit. It's not really a skill, but it's more of a characteristic. I think COVID definitely proved that if you did not have that perseverance, it was going to be a little more challenging than the person next to you that does have grit. It definitely takes a sense of advocacy and courage to continue to fight for what you believe in and stick it through, even though it's harder and it's challenging. You don't see the light at the end of the tunnel, but knowing that you're doing the right thing and long term, it's going to benefit the greater good and your care team, that definitely takes you a long way. So making sure that you have that tenacity to continue to persevere, I think is important.
I agree with all of those. I also think that collaborating, realizing that you can't be, it's not an I, it's a we. In healthcare, if it's this is my job, this is my task, you won't ever be successful. It needs to be, how can we collaborate together to make this process the smoothest, regardless of whether it's for a patient or for workflow, but it's teamwork and collaboration, and being able to be a team player is essential, along with the communication and the flexibility and persevering. So all of those things.
Thank you. Students, again, you can use the chat, or you can just unmute yourself and ask a question. How have you guys, maybe not you specifically, but your hospital, and we can all see the growth that you guys have had as far as buildings and things like that, but with the growth in Montgomery County, with us being the fastest growing county in, I think, not just Texas, but the United States, how have your individual hospitals been able to handle the growth that we are all experiencing in the schools and other businesses and things like that? How have your hospitals been able to take on the ever-changing number of people that could be needing services?
I can take the first part of that. We recently built a new tower, so expanded our garage and also our inpatient capacity. So while the patient population is increasing, it's nice to have more beds, but we also want to make sure that we're being efficient and admitting those right patients and getting them out as soon as we can, because we all know the longer we keep patients in the hospital, they're susceptible to infections and stuff like that. So, just making sure that we're maximizing our resources and putting those right patients in those right beds. We do have plans for another expansion in the coming year. So right now we're also opening up another hospital on the Cypress location. So there are several things coming down the pipeline, but it's nice to have nice beds, but we also at the same time need to do our due diligence and be efficient.
Yeah, similar to Alicia Memorial Herman, we just on the Woodlands campus, we just finished our 8-tower story South Tower building and opened that a couple of weeks ago. So we've all had capacity constraints due to the community exploding, but we're happy to have the growth, but we also need to, be flexible and adapt to what the community needs. So that it also entails constantly talking to our community members, right? Making sure we know what they need. Is it a bed or is it more resources out in the community? Getting out there and partnering with prevention interventions and things we can do to keep them out of the hospital. Those are some of the things that we also strategically need to also be talking about, even though we are brick and mortar, but we want to also expand outside of the hospital. So staying in touch and communicating with the community leaders and the members to make sure that we're meeting their needs as a healthcare entity.
Yeah, so to speak to an outpatient setting, which is where I'm at, I think that, to the point of everyone, it's logistically looking at data, working with your business leaders and executive leaders to identify through the data the types of patients that you anticipate seeing and projected volumes, and then making sure that you have a plan of space, but then also an opportunity to enhance your space. We recently here have opened up another 30 clinic rooms, and we have additional infusion treatment rooms that we can open. So it's when you build a space, don't build it without the ability to continue to grow it. And so that's where we have really worked hard, is that we have a space, but within our space, we have projected room to continue to grow to meet the needs of the community.
When I'm out in the community, I make sure I'm going out a little bit further, because I know we get a lot of people, and I'll say we as an MD Anderson plus the Woodlands in general, that we get a lot of people from, the Dallas area that need to come in or somewhere in between here in Dallas. I've been spending a lot of time over off of 59 with the smaller towns in Porter and those areas where they know they can come this direction for things instead of going down and dealing with the medical center. Because it's for people that don't spend time down there, not in healthcare, it's terrifying when you tell them they have to go to the medical center, and it's a little less so when you tell them they can come to the Woodlands. So I'm adding to the problem, guys, sorry. The good problem, it's a good problem to have, but it's nice that people can stop here and not deal with parking garages and, the pay, it's already financially an issue when they go down and have to pay. So I'm glad that we're in this area and we have so many options for patients.
And Kendra, we hear that from our patients and family as well, that we're becoming the medical center of the North, and being able to provide them the resources, it's definitely beneficial to this area. So it's a great place to be.
That intimidation factor is definitely taken away whenever you can stay local.
I know I don't want to go down there, so I know they don't want to.
Yeah. Okay, so students, I can continue to ask all the questions, but I want to make sure that I give you a chance to learn as much as you can from this panel. Says nursing informatics was a career that was mentioned earlier, and and she was wondering what that job entails. That's the first I've ever heard of it too. So you can give more detail as to what that career could look like.
So nursing informatics is more of like the technology. They pull a lot of data. So they basically really focus on your electronic medical record and how we can improve it to pull reports, to make sure that we're compliant with Joint Commission and CMS, make sure that our documentation is met. There's a lot of metrics that they pull from it, but they also then identify as nurses having the background and the knowledge of what a bedside or a clinic nurse, or basically the need of documentation, and they'll build platforms for us to document in. They help with upgrades on our electronic medical records. If anybody else wants to jump in on that one, that's pretty much my background knowledge of it.
Yeah, I think that's pretty much the gist of it. What's really cool about informatics is that they really advocate for the bedside nurses for what is the need technology-wise and documentation-wise. They're able to pull in the clinical aspect in addition to the technical aspect to say, hey, these are some new things that are expected of our bedside clinicians, but the documentation piece of it or the technology piece of it is not aligned. So what can we do as a system to facilitate meeting both of those expectations? We have a lot of regulatory bodies and people that tell us, you know, what information is needed in our documentation space. So they really are the stopgap or that liaison for us to make sure that we're educated in what technology and what documentation is needed, but then they also, we also partner with them to make sure that we're doing what is right in the technology space.
Yeah, and we've utilized them here for like lean initiatives and just to kind of refine some of those workflow processes. So they brought in our Voicera devices, which is the little device you can pin on your shirt. You can press the buttons, you can call people directly from it. That saves nurse steps having to go find a telephone. We also have military grade rover devices that the nurses can scan medication in. It looks like a phone, it can go in your pocket. They can take wound photography. They can document medication, scan medication. So all of that can be done from that handheld device. So, and when we roll out new technology, it's that informatics person that's going to the bedside and getting feedback, because we know with new technology, it's not necessarily perfect. So those bedside nurses who are actually utilizing it is giving the feedback back to informatics just to, you know, tweak it. So that way it makes it easier for the team, because the last thing we want to do is roll out new technology and everybody hate it and not utilize it. So we really need to make it work so that way it's getting utilized by those people that are actually utilizing it.
So is that a nursing major or is that a more technology? Like what's that like education route?
It's a nursing degree, but you can you can go back and get an informatics degree, or you have some institutions who just may train them for that role as well. So it may look different institution to institution.
Okay. Okay, Mary, if you would like to unmute and ask your question. Thank you, guys.
What was the process of getting a job? Because I know for my brother, when he like graduated, he graduated as a chemical engineer, and it took him a while because after college to get a job, because like the oil field declined. Is there a lot of movement in y'all's position like that? Like, was it easy to get a job? Was it harder to get a job? Like, what was the timeline for y'all?
I had a job before I graduated. I completed an externship after my clinical rotation, so I already knew where I was going to work. I just had to hope and pray that I passed my NCLEX and I hit the ground running. I think currently today, we're begging for nurses. We have a shortage of in nursing, honestly. We have our baby boomers that are continuing to live great quality of life. And so we have to help take care of them. We have nurses that are retiring. So we are needing more nurses. So I don't think it's too difficult to get a job right now. So just making sure that we have a good input of nurses and have faculty members to accept them into our academia space to allow for more people is really the challenge I think right now we're facing.
And to piggyback on that, I agree. I had a job before I graduated nursing school. And yes, you mentioned right now, we do need the nurses. Our executive team works with the area nurses, the nursing schools, to see what their need are. And they're hinged right now with getting students and just for clinical space, because everybody's fighting for clinical space. So, they'll reach out to them. What do you need? We need more clinical space. So we're taking on more students in our med surg critical care so they can, accept more students into their program, which will help us in the end of producing more students who will hopefully stay in the area. But I think the biggest thing, if you are a new nurse, is identify what hospital you're interested in. I kind of foresee what community you want to live in after you graduate, and then kind of apply to those graduate nurse programs and just market yourself, because those units only take a limited number of students, and then you're competing with other students in the area, so you really need to market yourself. And at the end of the day, when I am doing interviews with people, I can teach people skill any day. It's that people personality that I'm looking for, is how is this person going to mesh with the staff that I already have. So that's kind of what we look at. And when we do the interviews, it's not just me and my manager. We invite staff as well to interview, because at the end of the day, they're going to be the ones working with those new graduate nurses.
Yeah, I agree. I had a job prior to graduation. I think that for most of, my colleagues that I know, it was the same for them. One great thing that they have now that they didn't when I was a new grad is new grad internships, where they really take and cultivate you. I know at MD Anderson we have it, and I believe, Methodist and Memorial Hermann do as well. But it's a program where they take you, and for us, it's a year-long program right after you graduate, and then we give you in-class education to really hone in your clinical skills, to help you be successful and not feel overwhelmed, to help you with your confidence, and knowledge, kind of just being able to put all the pieces together, all that education that you got throughout your nursing education career, but then actually being able to implement them and put them into practice, along with a preceptor who is the one that you are with while you're in orientation, and then becomes like your mentor and your person, like Alicia had indicated, that you can go to, and that if you have a question, or if you're having a rough day, or if you just need a resource, that person is there for you. So we really try to cultivate improving you, and also making sure that you are delivering safe care that you are comfortable with.
Are there any school groups, clubs, community groups that you were a part of in college that helped prepare you for your career, or maybe even prepare some of those skills that you guys talked about, whether that's on the clinical side or the administrative business side, that the students can maybe look into because they're going into their senior year, so they're starting to think about what schools they apply to and go to. And so maybe some of the things that you guys were a part of that could help them when they're deciding where to go to school, or what to sign up for, and what to look for at fish camp, and all the things when they enter into their freshman year.
I'll take a little bit of that. I mean, I grew up in a small town in Mississippi, so there wasn't a lot of things I was involved in that I guess helped me get where I was. I would just say it was life experiences, and you have to be willing to step out of your comfort zone. And that's even true today, because when you step out of your comfort zone, that's when you will do most of your growth and learning. And so that was applicable back then in my early days, and it's applicable today. So I'll just say, don't be scared to take that risk and jump out of your comfort zone, because that's when you're going to do most of your growth and learning.
Just to add to that, it wasn't necessarily like anything I did to prepare for nursing school, but exposure is everything. If you have an opportunity to volunteer or to serve as a patient care assistant or nursing assistant, those also give you some avenues to introduce yourself into healthcare and really trying to gauge where exactly you want to be, because as we all discussed, there's so many different things you can do in healthcare, not necessarily bedside nursing. Could you be a dietitian? Could you be a respiratory therapist? All of that really just starts with an introduction into the healthcare space. So there are definitely other things you can do right now as a high school student to see where you belong and where you fit in if healthcare is your area of interest.
I'll just say a little bit on that. I wasn't part of any clubs or anything like that, but I was a high school and college athlete. And I think that teaches you so much more than just, whatever sport it is you're playing, on top of it helping to pay for college. If you can go that route and get a little bit of a scholarship. But employers really look at that because they know it forces you to manage your time because you're trying to do both. It goes back to grit as well. If you're an athlete and you know that you need to try to do both, and you're competitive and all the other things that come along with being a competitive athlete, and still taking a full load and keeping your grades up. And don't be afraid to tell employers that and to put that somehow on your resume, because that's and along with working, if you also had I also held a full-time job while I was in school. And so it's okay to say those things because it really shows what kind of person you are. So if you can put it into your cover letter or somehow put it on your resume, then do that. It will definitely, it'll help.
Kendra, I completely agree. So when we get all those graduate nurse resumes and we have 100 of them and we're sifting through them, we're looking for those students who could multitask, athlete, job, and, was making it work, because, being a GN, it's very challenging, and you're absorbing a lot of information, new job. So those are some things that we look for when we're kind of sifting through those resumes.
Go for it. You can ask your question.
Okay. So, to become a nurse or doctor or anything in the healthcare industry, it's a long process. So when you were deciding to make the choice at the beginning of your years, did you ever feel like it was like daunting, or that you were committing yourself to something you really didn't know where you would end up?
I personally did not feel that way. Again, I think with the way I grew up and already having exposure to what a caregiver looks like, I already had an inkling of what I was getting into. Again, I know everyone's journey is different, which is why I mentioned, even if it's volunteering or even if it's, doing a part-time or supplemental job like a PCA or something like that, that will really set the tone for you personally to see where do I think I belong before starting the intense journey of nursing or doctor, physician, or anything like that, because you do invest a lot of time, I'm not going to lie, and it is a sacrifice going through school and the studying and rigorous curriculum. So I definitely would encourage that you seek out some more information before taking that step. There's nothing wrong with starting and saying, I'll shift gears. I think Miss Alicia said she did that. There's nothing wrong with that as well, but you definitely can be proactive in seeking out some opportunities and resources, finding a mentor to see if anybody would allow you to enter the healthcare space and get some information before taking that journey.
And one of the beautiful things about nursing is you may, started in an area that you thought you'd totally love and you didn't. But the beautiful thing about nursing is there's so many different areas you can work in, whether it's inpatient, you can do critical care, mother, baby, you can do ER, or you can go to the outpatient setting. So that's one of the really nice things about nursing is there's many different areas that you can work in if you didn't really like one area. And, I did the 4-year degree. I didn't really think much about the time. I just knew that it was just a small blip in my life and it would be a big investment in the future. So to me, it wasn't really daunting.
And I think no matter what you do, go ahead.
I was just saying they've really streamlined degrees now. So it's not like when in the 90s when I was trying to muddle my way through to get a nursing degree, and they didn't have like a straight program. Now it's very, if you have an idea of potentially what your end goal is, we all know that we all have to get the basics regardless of what degree we're going to go to. But nursing you can be a nurse educator. You can have your master's in nurse education where you just educate people if that is something that you educate nurses. There's also a pathway where you can go and be a nurse practitioner, get your master's in nurse practitioner degree. And they have really done a fine job of making it straightforward and helping you get a degree that's going to support your end goal. And a lot of our institutions have tuition reimbursement, which for me was a huge benefit. My dad paid for my first degree, and I was the one who was going to have to pay for all my additional ones. I worked like everybody else did through all of my degrees full time. But when I got hired on with MD Anderson in '98 with my licensed vocational degree, MD Anderson has paid for my last 2 degrees, and they do it through tuition reimbursement, which, the big institutions all have a form of reimbursement that will help us be successful so that we can work and then, continue to further our education and our career while we do that.
And I think we have to remember too that we can't sit here and say that there's never times where we were tired and maybe we didn't think about quitting. And it's a long haul. And my family and friends used to think I was a little crazy because I would find things that motivate me. When I was a young person, it was a car or a kind of house that I wanted. And then when I was older, it was my family and my son. And, and I always wanted a log cabin. This sounds nuts. I never got a log cabin. But at the time I thought that was what I wanted. And I had a picture from a magazine and I had it hung up where I would sit and study, because that was the way. And whatever it is that motivates you, if it's, caring for people or a certain person in your life, then have that visual there to remind you, because we all get into those spaces where, in our head space where we're doubting what we're doing, and just, we're all motivated at times, and then we're all also not motivated at times, and just find what works for you and power through.
Audrey, did you have a question?
Yes, ma'am. So I know y'all are all experienced and very professional nurses. And what is like the biggest, like the hardest thing a new grad has to adapt to a nursing lifestyle? Like, what is the hardest thing y'all have to learn to be like a very professional and good nurse?
I can take that. I think one of the challenges for a GN is you're a new nurse, but you're also trying to establish being on your own and being independent and being part of the team. And those first few months, it's very critical for you to be able to accept feedback and learn from it, because that's what's going to really make you grow as a nurse. So just understanding from those nurses who have been doing that role for a while is being willing to accept that feedback, because in that short amount of time, you're going to be getting more feedback than you are probably kudos. So I would just make yourself vulnerable and be willing to accept the feedback, because in the end, that's what's going to help you to be the best nurse that you can be.
Being able to accept constructive criticism is key. Even after 24 years of being a nurse, we're human, right? And so we walk into new situations every single day. And to be able to step back after a situation occurs or a learning moment and realize, oh, I could have done that differently. How can I make it better next time, for myself, for the other individuals that were involved in it? So I think, being open to know that you don't know everything. I think I think all of us nurses say the scariest person that walks into a healthcare facility is the person who thinks they know everything, because you're not open to recognizing that you potentially are making a mistake. So be open to learn new things, be flexible, be kind to yourself, right? It's okay. I think a lot of people are, perfectionists. You want to do it the right way, right? Everyone in the healthcare doesn't want to come in and make a mistake. But recognizing that we're human, and being willing to learn from everybody and learn every day, because every day you can learn something new.
Yeah, the one thing for GNs, I always tell them when we interview is I'm not looking for someone that has all of the skills already. We already know that you're coming in with book knowledge, and we're going to have to teach you the bedside knowledge, which is how you're going to day-to-day make sure you care for your patients safely. What I'm truly looking for, and I encourage them to come with an open mind about, is something we talked about earlier, is just the perseverance. It's not going to be easy. We won't lie to you. We will give you that constructive criticism, and you need to be open to receiving it. Those that struggle a little more are the ones that don't receive the information. I quickly remind them, your success is my success, and our success lends to great patient care and quality outcomes, which is essentially why we all come into in nursing. So making sure they understand that the culture that we want, it's a culture of positivity and openness, and ensuring that we have effective communication. So I haven't mastered mind reading, and I always tell them again, if you stop asking me questions, I'm also concerned. So we need to constantly be talking. What do you need? What do I need? And if we have that collaborative relationship, we're going to be successful, and you're going to be successful.
Great question. Thank you. Can you guys talk to, some of you have mentioned this along the way, Anisha, I know you mentioned it, but talk to the importance of kind of finding the mentors or the cheerleaders, or maybe who those were along your journey that kind of helped, maybe not making the decision on what to do career-wise or something, but kind of helped you through times where it was like, I just need to talk through things. But I've learned through these fields that there's kind of, people have them throughout different stages of their life. And whether it's in your first job, in college, kind of talk to the importance of finding those people, not just in the career, not just within your career world, that can be advocates for you or be cheerleaders or be ones that are your sounding boards and things like that. I know some of you have mentioned it, but it's one of the big things that we find important at EfTA, especially nowadays for young kids going off to college, going into careers. Like, there's so much pressure that having the importance of finding someone outside of home, if you're moving away far, and all the things.
I know for me, I leaned heavily on my coaches, and I still have my high school coach. We still talk today, and we can, me and a few other girls from our team can still go to her, and we still invite her to family functions and things like that. So, and that for us, that was somebody we could really lean on, that was a little outside of our family units.
Yeah, I think my mentors per se, we didn't coin it. I feel saying back then is like we're old or something, but you know, when I was going through nursing school, I think I had people in my lives in different seasons. As I embarked into nursing, my mentor was my mother. You know, she was my encourager. She was the one that, you know, helped me figure out that this was what I needed to be. This is who I was growing up. So she helped me take that leap of faith and say, I'm going to nursing school. During nursing school, it was my peers, my colleagues, you know, they had similar backgrounds, they were motivated. So we flocked together and encouraged each other, you know, just like Ms. Kendra said, there were times where I didn't want to take one more book, one more step, one more exam, but you know, I had my peer to say, we can do this, we got this, one more semester, and that kept me going, you know. And then starting my career, you find those peers that you really cling to, where you want to be that nurse that knows it all, that confident nurse. So you seek their knowledge. So you ask them questions, you use them as your sounding board. And then I go into leadership, you know, and I have that awesome manager and want to aspire to be someone like that. Then I ask them questions, and I also ask them to be my mentor and my guide as I embark on that journey and find my career path. So I think it depends on the season, you know, people come and go into your life. But one thing I know helped me to get where I am today is seeking out that knowledge and having the courage to have those conversations and receiving the feedback. Because regardless of what your journey is, there's perceptions. And if there's something that's hindering you from aspiring or getting to where you want to go, you have to be open to learning what you can do better, right? And if you want to get better, then ask for that information so you can continue your journey and your pathway.
And
I would say,
go ahead.
Go ahead.
No, I was going to say, when, you know, Methodist has found having a mentor really valuable, and also bridging that gap with technology. And so we've called it our mentor match program. So one of the things that we're doing is, if you want to be a mentor or you need a mentor, you kind of go into the database and plug in your information and kind of what is your area of expertise, or what are some areas that you're needing help with. And the computer matches those two people together. And then, you know, you have the mentor and you have a mentee. So that's kind of something we're doing on our end for those that want to be a mentor, and then those that need a mentor. So I think it would be a really good program, just to help people that's been in the system for a while, and those that kind of need that mentor to help them to kind of navigate whatever they're going through.
I would say that, you know, at the season where the individuals that are on the call it's your senior year, you're heading into colleges, surround yourself with people who have like goals. You know, individuals who have the same drive, who have not necessarily the same degree requirement, but that they know that their next step is college. Because when you surround yourself with individuals who have the same priorities as you, then you won't get derailed. It's easy to, when studying is hard, you know, going and getting a career and going to college, it's not an easy thing. And it's a transition, right? There's a big difference between high school and studying for a high school class and going to a college class. You know, you are paying for this education, and not all of your teachers are going to care if you show up for school, right? It's your choice. It is your decision to come to college, to study for your classes, to get what they're trying to give you. And so if you are around individuals who aren't as motivated and that's not their goal, then it can be very easy, especially your first semester of college, to kind of get derailed and decide that it's going to be more fun to go to that party on Friday than to study for for your big exam. So that would be my recommendation.
Birds of a feather really do flock together.
Okay, so students, if you guys have any questions, now is your chance to get them in before we get close to wrapping today's panel. So I'm gonna ask one of my final questions, and I have a couple more, but students, again, if you have any, now's your chance. What is that, and students, if you've been on this channel before, you've heard this question, but what's that one piece of advice you would go back and tell your 18-year-old self? A lot of the things you guys just mentioned were good ones. I would go back and tell myself.
I think for me, I would tell my 18-year-old self, learn how to study. College studying is completely different, and I kind of mentioned that, but I think that was probably one of my biggest takeaways. When I went and signed up for a full load my freshman year and ended up having to drop 2 classes because I couldn't manage my time, work full time, manage all of the classes and study because I hadn't quite learned how to study for college. And so being okay with going into it slow and learning what you don't know so that you can be successful from the beginning.
I think someone mentioned this earlier about going off and experiencing more things. And I think I stayed close to home because I felt like I needed to. I had some individuals I felt like I needed to take care of in my house. And I'm sure we've all felt that way at one time or another, but I would go back and tell myself to explore more options. And my options turned out just fine. So I'm not regretting any of that. But I do, at least when I was a younger person, would look back and wish I had sort of spread my wings a little bit more and looked at options outside of those in the immediate area. So just make sure and look at all your options. You can still choose to stay, close or whatever, but I wish I had at least looked.
I wish I would have stepped outside of my comfort zone, maybe not necessarily my 18-year-old self, but maybe more in my early teen years, because hindsight, I think you miss out on some things when you choose not to step out of your comfort zone. So I am doing the same thing with my daughter now. And I think when she gets older, she'll appreciate me pushing her out of her bubble because I appreciate when my mom did that with me. I just wish I would have done it younger.
Yeah, kind of similar to Alicia and Kendra, I would say to have courage. All of the kind of examples that they're giving is it really lends to finding yourself, your voice, and stepping out and doing something different or asking questions that you probably are afraid to, but really not allowing yourself to regret it later to say, I wish I could have. When the ramifications were probably going to be something as bad as a dirty look, but at least you asked, or at least you tried to do that one thing that you aspired to do, but really didn't have the courage to do it if it was another situation or other circumstances. So courage, I would say.
Those are all great. Thank you, guys. Okay. Last call, students, if you have a question, please unmute yourself now. Okay. All right. Well, I want to, if you guys are done with your questions, I don't want to keep you guys any longer and make sure that I can get you guys back to your work days. And students, if you've got your online sessions coming up, or you're working on your interview homework that's due on the 30th, I want to make sure to give you guys time to do that. So students, and we cannot see you, but can you help me thank our panelists for joining us this morning? Thank you guys for joining us for your first time, but also for your just continued commitment to our EfTA programs and our students that go through all the things that we provide throughout the school year and in the summer. So thank you guys for the work that you do in your hospitals and for our community, and for joining us again this morning. And I hope that you guys have a great rest of your day. Students, thanks for joining. And if you haven't RSVP'd for the luncheon next week, please do so today so that we can get your ticket confirmed and all the details. So hope you guys have a great rest of your day. Thank you so much.
Thank you.
Thank you for your time.
Thank you.
Thank you.
Thank
Thank
you.
you.
Thank you.